Doctor, hindi lang mataas yung mabilis yung transmission, diba? And the Octa is warning that baka daw by the end of the month, mga 11,000 na, pumalo na ng 11,000 a day yung number of fresh cases. At what point will the hospitals be overwhelmed? Siguro natin dun sa mga COVID referral centers muna.
Well, ngayon po, pumapalo tayo. We're like what, hitting like 4,000 to 5,000 a day already. And now we are about 80% full. Ito yung PGH. No? We actually, what happened was, just to backtrack a little bit, we actually contracted our operations for COVID because it was getting smaller. And so now we had a chance to reopen our non-COVID wards, open the rooms, convert some of the COVID wards to non-COVID operations. And so now we're trying to get it back. Kaso ang problema, nandiyan na rin yung mga non-COVID. No? So we went as high as 240 at one time. PGH was able to give those beds. But at that time, the non-COVID patients were still afraid to go to the hospitals. Kaya parang madali sa amin na, sige, buksan lang natin. Total, wala namang pumupuntang mga non-COVID patients. But then there was a lull that's when the non-COVID patients, now the patients with cancer, heart diseases, kidney disease, who needs dialysis, ayan na sila, pumupunta na sila sa hospital. Now they are in our hospital. It's so hard to recover these beds because they are there, physically there. You cannot just move them and, okay, let's... So right now, PGH is, we have stretched our beds again for COVID to almost close to 200. And we have about 160 over 200. So almost, 80%. Now, you were saying that kung 11,000 or 15,000 a day, siguro kung ganun talaga ang rate, baka in 2 to 3 days, wala pang isang linggo, puno na rin kami, puno na rin yung iba. Because, there are no other, if the hospitals, the big hospitals, the major private hospitals say that they are full, saan pa pupunta yung mga tao? We have some of our we have private patients actually, but these are actually patients who probably could not just get into the private hospitals kasi puno na sila. So, no choice, they have to go to PGH. No? Majority of our beds are for the charity patients.
But there's actually a possibility that you will be overwhelmed kung ganyan ang mga numbers?
Pwede po. Kasi, well, right now we're okay. Parang kaya pa. But the problem is, once you do not have, I think I mentioned this in the news yesterday, we can say that we're better prepared, we're knowledgeable, we have the 1-year experience of taking care of patients. But if we do not have the rooms or the space in the hospital, how are we going to take care of them? If they will be staying mostly in the outskirts of our emergency room or yung iba, kalat-kalat po, napakahirap, no? The other concern will be manpower. Right now, we're okay. We were able to get most of our nurses back. We have doctors, trainees, consultants who are manning our COVID wards. We're still okay. But what we have experienced in the past is eventually people get tired, people get sick. Isa nahawa po. Kaya mahirap, no? We have actually a request from DOH if we could get some more volunteers again, maybe about 30 to 40 medical doctors / nurses, medtechs from DOH. We do not have the budget to pay for these people anymore, so we're asking DOH maybe if they could pay for their salaries and augment our workforce. Pang ano lang ba? Pang sub, kumbaga pahinga lang, no? Parang relyebo.
A lot of hospitals, including private hospitals, are saying, okay, we're hitting critical levels now. We are afraid na baka we might run up against the limits of our own facilities. What's there to qualify there? And are we getting near the point of having to ask for another timeout?
Right now, actually, the experts are saying that no, not yet, because right now we already have some experiences with the past, and so we can manage these COVID patients better than before. So with that, at least we can probably hold out much longer.
What's how much longer on the, let's take the numbers over the past few days. Medyo bumaba today, but it's still more than 4,000, 5 straight days already. Let's take the numbers of Okta Research predicting 8,000 if nothing changes by the end of the month, 18,000 by the middle of April. Will that cover, I mean, how much longer we can hold out, in your words?
Well, actually, the figures are really alarming right now. And before, I was thinking that after probably another 4 weeks with that continuing trend, then probably we'll have just like the August 2020 situation where there were full houses or full COVID beds in almost every hospital. Hopefully, it doesn't arrive at that scene.
Dok, ang sabi po ng DOH, sabi ng DOH kasi sa Metro Manila, yung COVID occupancy ng mga ospital nasa 60 to 70% lang. So, kahit pa paano raw, hindi pa naman ganun kalala. Pero I'd like to ask you to qualify that kasi what we heard nga, and that's been confirmed, yung mga major Metro Manila hospitals, fully booked na po yung COVID wards. Yung Medical City, Asian, St. Luke's, Cardinal Santos, ito yung mga malalaking ospital. So, I suppose what that means is that yung mga malilit na lamang na ospital, yung medyo meron pang existing COVID beds. But then again, magkakaiba po resources ng dalawang yan. Di ba? Yung big hospitals have all the resources, have all the manpower. The smaller hospitals do not. So, is there anything to qualify there po? Should we be reassured by that 70% or should we be worried with that?
I think we should be a little bit worried already because there are around 159 facilities in the NCR.
Okay.
And out of the 159 facilities, around 20 facilities are in the critical level already. And another 23 are in the high-risk level. When you say high risk, it's 70 to 85% occupied. And if it's critical, it's at least 85% up to
Higher.
full capacity.
Okay.
Yes, and there are 20 facilities that are already in that point.